Hello, my name is Dr. Carlo Renato. I'm a chiropractor from Sydney, Australia. Well, by now, hopefully you're aware that I'm heading to Rome September 22nd to 23rd to present one of my favourite seminars, Managing the Dizziness Patient. It's really about upskilling chiropractors in being able to better identify, communicate and manage patients with psychogenic dizziness as well as other vestibular-based conditions. It's something that we're not taught at uni particularly well, if at all. It's something that most of us see in practice. We see the dizzy patient and we manage these patients by our normal manual therapies. Whilst that can work for a number of people, it doesn't work for everyone. So this seminar is really about bringing you guys up to that next level in terms of understanding and managing people with vestibular-based conditions. This little video, I'm going to be talking about benign paroxysmal positional vertigo. It's the condition that we see most in office. Okay, it's probably the most common. It is the most common vestibular or dizziness or vertiginous-based condition that we see in office. So we're going to spend a lot of time going through a lot of the subtleties about it. We're going to talk about the mechanisms, what happens to those crystals in the inner ear, to those calcium carbonate or otoconia in the ear. How do they get displaced? What populations do they tend to happen most in? Which canal? Is it the anterior? Is it the posterior? Is it the horizontal canal? Is it the variant that attaches to the cupular lithiasis? Or is it the variant that attaches, that floats freely within the canal, called a canal lithiasis? Most of us do, or unfortunately, do a single maneuver. We do the Dix-Hallpike maneuver, and then they do the Epley's maneuver. But unfortunately, it only works on a percentage of patients. There are so many different variations that we should be aware of. That's probably the reason why that we don't get the results that we expect when we do that one size fits all. All right, so we're going to upskill you guys so you can identify the different variations of BPPV, which side is affected, firstly, which of the three canals affected, or a combination of three canals, and which variant, because the particular symptoms, the eye movements that relate to that, and the treatment will vary considerably, as well as the take-home messages that we give to our patients as well. So unless you understand and can discern the differences between each of those, you're flipping a coin and hoping for the best. So let's not do that. Let's get better at identifying and managing these patients with the most common condition that's likely to land in your office. Okay, so we're going to spend about an hour and a half, even up to 2 hours, really breaking this topic down. So we're going to go through assessments, and really assessments will always depend upon what the eyes are doing. What's the direction of the nystagmus? How long does it last? Is it improved with head movement or not? We're going to go through management. We're going to break down what management, what maneuver should we be using to help apply to these patients as well. So don't think this is, well, I do it already with an Epley's maneuver, so it works for everyone. It doesn't work that way. All right, so let's get better at doing this. And we're going to spend a lot of time covering that. So this is one topic that we'll cover in our seminar. And really, it's one of many in upskilling the chiropractor in being able to identify, manage, and communicate what is it that we do in office to a higher level. So be sure to join me in Rome, September 22nd, 23rd, for what plans to be a great 1.5 days of content. It's something that I've been sharing now for a number of years, and I really look forward to sharing it with my colleagues from Italy and surrounding countries. Early bird closes August 24, where you can save some great, you get some great savings available. We're likely to sell out before that, given the interest that we've had so far. So be sure to register and secure your ticket, your early bird ticket now. Until then, I look forward to seeing you in August. Oh, sorry, no, I look forward to seeing you in September. But make sure you register in August. Take care for now.